Knock. How you doing, sir? My name is Nathan. I'll be your student LPN today. What I'm gonna do first is I'm gonna go ahead and wash my hands, provide privacy, and the first thing I want to do is I want to ask you what is your name and date of birth, and while you tell me, I'm gonna look.
Severio Scott, March 7th, 1988.
All right, appreciate that, and I want to also ask you where are you right now?
Hospital.
All right, do you know what day it is?
Sunday.
All right, and can you tell me why you're here?
To get an assessment.
All right, thank you. We're gonna go ahead and chart that real quick. All right, I also want to let you know that we got your vitals. The PCT took care of that, thank goodness. So now, we're gonna go back and check that later, but for right now, let's go ahead and do this head to toe assessment. The first thing I'm gonna do, document AO times 4, alert, awake, aware, oriented, AO times 4. So now what we're gonna do next, we're gonna go ahead and assess the hair for lice, abrasion, edema, things of that nature. All right, everything's looking healthy. There's no signs of lice, no signs of abrasion, no signs of edema, and his hair texture, silk and smooth. So we're gonna go ahead and chart that real quick. Chart. All right, so after that, we're gonna go and make sure that the face is symmetrically equal. All right, face symmetrically equal, no signs of deformities. Chart. No signs of him used to have a stroke or nothing like that. So now next what we're gonna do is we're gonna check the eyes for perla, make sure that they dilate and constrict. All right, so I need you to just look straight at me. All right. All right. Perla intact, pupils round, equal, reactive to light and accommodation. Chart. So now next what we're gonna do is we're gonna go to the nares and nostrils just to make sure that everything's breathing right. Sir, if you can, just go ahead and put one finger on one nostril for me. Breathe for me. All right, can you put the other one on another nostril? Breathe for me. All right. Breathing sounds good. Breathing's normal. Have the ability to breathe through. Now, we're not done yet. What we're gonna do now, we're gonna take a look in the nares just to make sure that everything's pink and intact. Everything is pink and intact, slightly moist, no signs of congestion, excess drainage, no signs of that, so we're gonna go ahead and chart that. Chart. So now what we're gonna do next is we're gonna do the oral mucosa. We're gonna do the mouth. We're gonna take a look at the mouth, go ahead for oral mucosa, the tongue, the teeth, the gums, things of that nature, just to make sure that there is no signs of cyanotic activity, which is a change of color or anything like that, no signs of edema, anything of that nature. So what we're gonna do, we're gonna check real quick, man, just say ah for me. All right, cool. Tongue pink and intact, gums pink and intact, teeth look strong, no signs of dental cavities, no signs of dentures or anything of that nature. Everything intact, pink, moist, healthy, no excess saliva or anything like that. Oh, chart. And can you please cough for me, man, so I can make sure that he doesn't have a dry cough or a productive cough? Dry cough, all right, that's good. Go ahead and chart that, chart. So now what we're gonna do next is we're gonna check the neck. What we're gonna do is we're gonna check the lymph nodes, symmetry of the trachea, and the carotid arteries. What we're gonna do with the lymph nodes is we're going to check for abnormalities such as, nodules or any kind of swelling, abnormal nodules. No signs of any abnormal nodules. Now we're going to check the symmetry of the trachea. All right, can you swallow for me real fast? Trachea symmetrically aligned, equal. Now we're going to check the carotid arteries for any signs of Brug's or any signs of jugular venous distension. And right now we have no signs of that. Arteries is good, +2, strong. So we're gonna go ahead and chart that. Chart. And now what we're gonna do next is we are going to do the chest. We're gonna check for the heartbeat. We're gonna check ×5. Check for any murmurs, arrhythmias, anything of that nature. All right, times 5. So we're gonna start. I'm gonna do it like this, Miss Clark, so you can see. Aortic, pulmonate, earth point, tricuspid, mitral, apical. And we're gonna go reverse. All right, no signs of heart arrhythmias, no signs of murmurs. Chart, 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 chart. Now what we're going to do next is we're going to do the lungs. We're going to do the lungs just to make sure that his respiration rate is good. It should be between 12 and 20. And we're going to also check to make sure that he doesn't have any no abnormal sounds like wheezes, bronchi, crackles, anything of that nature. All right, so here we go. We're going to start from the top at the apex, and then we're going to work our way across, down, across, down, across. 1. All right, we don't have any signs for that. No signs of wheezes, no signs of bronchi, no signs of crackles. His respiration right at 15, so we're doing good right there. So now we're going to check the back. You can just stand if you want. I can help you if you good. Yeah, the video ain't going to see it. Yeah, that's cool. All right, we're going to check the back now. All right, here we go. Same thing. All right, again, respiration's at 15. No signs of wheezes, no signs of bronchi, no signs of crackles or anything of that nature. Breathing bilaterally equal. So now that we already got that check, I just got a few questions for him. All right, because I'm about to do his stomach, I'm about to do his bowel sounds, make sure all that is done first. So what I'm first going to do is I'm going to first inspect before I palpate. I'm going to first use auscultation. I'm going to listen. Now we're going to start first. We're going to start with the lower right quadrant, upper right quadrant, left upper quadrant, lower left quadrant. All right, now after that, we're going to go ahead and palpate. Start again from the lower right quadrant, upper right quadrant, left upper quadrant, lower left quadrant. You feel any pain? No. No pain at all. He has no pain. Now what we're doing here, while we're doing this, we're checking between 5 and 30 clicks. Anything below 5 is going to be considered hypoactive. Anything above 30 is going to be hyperactive, which neither he has. We did it about right at 20, so we're right in that exciting normal range right there. So, and we were also checking for masses as well. No signs of masses. All right, so I got a couple questions for you, man. So, when was your last bowel movement?
Today.
All right, so around what time do you usually have your bowel movement?
In the morning.
Okay, is that a normal routine for you?
Yeah.
Okay, good, good, good. What about urination, man? Do you have any painful urination?
No.
All right, good, good, good. That's good. Chart, 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 chart. All right, so now next what we're going to do is we're going to check the arms. We're going to check the arms just to make sure that he has no, cuts, no signs of edema, no signs of change of color, cyanotic activity, anything like that. Then we're going to do the capillary refills, and here we go. And hair distribution. All right. No signs of deformities. Hair distribution, smooth, equally distributed. Now we're going to check his hands for capillary refill. Capillary refill returns in about 3 seconds, so that's good. And now we're going to check both of his radial pulses, +2 strong. And I don't see no activities, cyanotic things going on, anything like that. Again, no cuts, no bruising, no open wounds, so skin is intact. Skin integrity intact. So we're gonna go ahead and chart that. Chart. So now what we're gonna do next, you can go ahead and lift back if you want. So now we're gonna do next, he's lifting right now. What we're gonna do is we're gonna go down to the legs. We're gonna go ahead and check the legs for the same thing. He chilling. Well, now we're gonna do the same thing. I got you, but I'm sorry. All right, so with the legs. Symmetrically equal. I got you. I'm sorry, bro. I got you. Just a little bit. All right, skin, hair distribution, smooth, evenly distributed. Again, no signs of deformalities, no signs of edema, no cuts, no bruises of any of that kind of nature. And now what we're going to do next, also no signs of cyanotic activity going on. So now we're going to check the feet. Capillary refill comes back in 3 seconds, so that's good. Also, we're going to check the pedal pulse. Bilaterally equal +2 bounding. And now what I'm going to also have him do is I'm going to have him push his feet towards me, and then I'm going to have him, which is flexion, then I'm going to have him press it against back, lift his feet up and press against for dorsiflexion. Sorry about that. All right, cool. All right, strength. Strength is good. Strength is equal. No signs of weakness on one or the other, while the other one is good. All right, so now after that, let's see. We're gonna take his legs one more time just to be sure. All right, good. So now what we're gonna do next is we're gonna go ahead and chart all that right there. Chart. And now before we do this, you're gonna look back down, Doc. Before we do this, we're gonna check the spine. That's it right there. Spine equally symmetrical. No kind of abnormalities. Sorry about that. Spine is perfectly curved the way it should be. Nothing's out of alignment. No kind of scoliosis of anything like that nature. So we're gonna go ahead and chart that. Chart. All right, and I just have a few questions for you, man, before I get out of your way. Do you use any assistance in walking? Any assistant devices in walking? No. Do you use any assistant devices when it comes to feeding? Okay. We'll go ahead and chart that real fast. Any assistant devices when it comes to urination? No? Okay, we'll go ahead and chart that. Chart. All right, man, I appreciate you. Thank you. Now, what I'm going to do first is I'm going to wash my hands. Take the privacy curtain back. Lift the bed rail up and put the bed down. Reduce fall risk. Wash my hands one more time. And I appreciate you, man. Thank you.